Hi, my name is Lee Fogel. I'm the author of A Matter of Life and Breath, which is my own seven-step guide uh, of how I recovered from near death with pulmonary fibrosis. Just like in my own life of working with medical professionals and exploring new healing modalities for myself, in this podcast and on my YouTube channel, we like to bring new, incredible information to folks suffering with lung disease. Today's special podcast is with Dr. Phil Harrington, who is the Chief Medical Officer of Summus Laser. And he's going to tell us a lot more about the use of Class 4 therapeutic lasers today for various types of injuries and tissue problems, as well as lung disease. You're going to learn how and why laser therapy has a significant effect on soft tissue injuries, and why this same therapy is now being applied to certain respiratory diseases. I am one of those early patients using this therapy for lung disease, and I have seen some amazing results. That's on a separate video on my YouTube channel, where my pulmonology reports from the hospital indicate empirical data that supports the effect it's had on me. So with me today is Dr. Phil Harrington. He's a doctor of chiropractic. He graduated from Iowa State College in '87 and with a degree in physics. That's good background for lasers. And in 1996, he graduated Palmer College of Chiropractic, which gives him that other dimension of the healing arts for us. He's not just an engineer and a physics guy. He was in private practice for 10 years, and he has also served as the medical director, the clinical manager, and the laser safety officer for Summus Medical Laser for 17 years. You need a medical safety officer, a laser safety officer, if you're going to have lasers around people. So that's a great role. Dr. Phil's passion has made him a much sought after national and international lecturer on photobiomodulation, laser therapy, science, physiology, safety, and clinical applications. So without any further introductions, I'm just going to say, Dr. Harrington, what got you from physics into chiropractic and then into lasers? Tell us more about that background.
Well, first off, Lee, I just want to say I'm so grateful for this podcast. Thank you for setting this up. I'm very grateful to have this conversation with you today and share this information with all of your podcast viewers. I really appreciate it. And just one quick thing, I do want to throw out a disclaimer. What I say is for educational purposes only. It is not meant to diagnose or determine treatment for any disease. People should be under care of a medical doctor if they are suffering from these lung conditions. So this information is for educational purposes only. And then also I want to say that any information that I share is my opinion and my experience only. It is not any indication on my employer, Summus Medical Laser. So it's what I am sharing individually as a person. But yeah, thinking back to those days at Iowa State University, I mean, first I started out as a college student. I had no idea, as many college students, you're not really sure what you're going to do in life. So I did actually start out first in engineering, but then something just drew me to physics, and it seemed like somewhat of a natural fit for me. I graduated from a very small high school in Iowa, and I had a little bit of physics education in high school, but the education that I got at Iowa State just was very appealing for me. So then once I graduated Iowa State, I taught high school at a school in southwestern Iowa called Harlan Community School District. I was a math and physics teacher there for 3 years. I loved it. It was an incredible experience, a great school, great students. I actually still keep in contact with several of the students that I had. And so that's been a lot of fun. And, part of me wishes that I would have enjoyed just staying in that same school district my entire teaching career. But then I felt that there was something bigger, and sometimes I say that I wish I could have cloned myself and won me stay teaching. But then I did have an older brother, Bill, who was followed a somewhat similar path. He started out as a high school teacher, and then he attended Palmer College of Chiropractic in Davenport, Iowa. And I saw what he was doing in his practice. I was able to visit him in his practice. I saw how much they were able to help people. Bill and his wife Gloria are both chiropractors, and they did a lot of work with nutrition and really, really helped people improve their quality of life. So that drew me to chiropractic. So I attended Palmer and graduated in '96, and then was in practice in a small town in Iowa called Brooklyn for 10 years. And I guess I always joke there that I don't have a Brooklyn accent. The first therapeutic lasers to get FDA clearance it was in 2002, and it was a device called the Microlight, and they got their FDA clearance based on doing work on auto workers in Detroit for carpal tunnel syndrome. So that's kind of where it all started. Now, back in the early 1900s, Albert Einstein theorized that it was possible to develop a device called a laser. He developed the quantum mechanics behind it. And then in the early 60s, there were some gentlemen, Theodore Maiman in particular, that did invent the first ruby laser. And then really in that period from the mid 60s through the mid 70s, there was just an explosion of different types of laser devices that were developed. Now, some of them were very high in power, and their laser light would be concentrated to a small focus, and those were the devices that would cut tissue. So those were used as surgical lasers, and they were given the nickname a hot laser. All right. Then there was a doctor actually working in Japan. His name was Glenn Calderhead, and he was doing work with one of those cutting ablative lasers. They were cutting off skin tags and doing various minor surgical procedures. And what they observed is that when they would cut with that focused laser, that ablative laser, that just off to the side, the tissue would look healthier. And so it actually got the nickname when it would cut, they called that the hot laser, because it was basically the mechanism is you get absorption by the water molecules, it vaporizes them, makes the cell explode, and then that cuts the tissue. And then off to the side, they call that the cold laser because, and I'm pointing this out because historically the terms hot and cold, it has led to much more confusion than led to any clarity. So throughout the history of lasers, from the mid 70s, we would have just a myriad of terms: low level laser, low reactive laser, soft laser, cool laser, cold laser. Somebody even called it a fuzzy laser. And all of those terms were really not helpful. And I like to point this out because the devices that we are using today, they are class 4 lasers. And in the laser classification scheme, you have 1, 2, 3, and 4. And the true definition of the laser hazard is by the direct exposure to the eye, okay? In general, and there's lots of fancy calculations that have to go along with that really get pretty complicated and confusing. But in general, we just define it by the power output of the laser. So if we get up to 500 milliwatts or 0.5, half of a watt, anything below that is considered a class 3. Anything above half of a watt is considered to be a class 4. So over the years, there has been some confusion and misunderstanding about that, because obviously the laser that is being used for therapeutic purposes, such as for these lung conditions, that is a non-ablative class 4 laser. The concentration of the laser light is low so that it does not break the skin surface, and it results in positive biological effects. Whereas the class 4 lasers that are higher in power and have that focused beam, they are used for surgical procedures and dermatological procedures. So historically, there have been some people that they have that misconception about that. And then also, sadly, there are some people that use that in an inappropriate way to denigrate class 4 laser therapy. So actually I have a few videos recorded on my own YouTube channel. It's called Laser Lessons from Dr. Phil. And one of my videos on there is called Class 4 Laser Therapy and the title is From a Maligned Modality to a Clinically Indicated Treatment. So when I started doing this whole thing of the use of class 4 laser therapy, when I say it was a maligned modality, there were people, whether it was other laser manufacturers or other healthcare professionals or from many different angles, they would say that class 4 laser therapy damaged tissue and hurt patients and burned patients. And nothing could be further from the truth. That's just a ridiculous statement to make. So now, fast forward to today, the end of 2024, there are many different indications, problems with patients that patients have, whether it's pain, inflammation, or tissue damage, that class 4 laser therapy is an indicated modality. It's really been an exciting transformation. And another thing that I like to say about this all is that class 4 laser therapy will be an integral modality in all fields of healthcare all around the world. And we're seeing that happen already. Actually, just this morning, I was looking at making travel arrangements to go to Malaysia and visit my friends in Malaysia. So we will do some meeting with different healthcare providers there and going to hospitals and Malaysia and many other countries around the world. The patients are benefiting from class 4 laser therapy.
That's very exciting information there to understand, first of all, the background, the history of this. And now I finally understand, after reading it for many years, what a cold laser is. Now I understand what a cold laser is. First time I've understood that. We will also put your website in our show notes and in our description on this YouTube channel, so folks can go out and watch more of this information from you. But I'm really excited what you just said, your last statement of it's going to be the indicated modality for many different types of injuries to tissue damage, pain, inflammation, things like that. It's really exciting because I've personally seen it. I've seen it on animals, and I've seen it on other parts of the physical body, joints, and I've now seen it in 2 ways on my own body. So I love it when new things are coming to getting. It takes a long time. I mean, the FDA approval 2002, I think you said.
Right.
That's 22 years ago, and now things unfold. But that's the way the medical community has to be take a conservative approach. So this is really very, very exciting. That tells us a lot about that. I mentioned this to you before, and it's actually in my book. In my book, I got probably 60 different things I tried over my period of time when I was focused on going from laying down in a recliner and able to walk 50 steps with an oxygen tank to being able to paddleboard, golf, play pickleball, swim, all those sorts of things. It took a lot of work to get there. But one of the things I tried, and I gave it a lukewarm indication in my book, was laser therapy, because I didn't know there was a class 4. I went on Amazon and I found some reasonably priced, I guess, and I had some discretionary income. So I spent about $400 to buy a class 3 laser. And first of all, I couldn't use it on my back parts of my lungs because I had nobody with me that could use it in those areas. But second of all, I used it without a lot of instruction, didn't know what I was doing, and it's too weak. I didn't get a lot. I felt like maybe there was some inflammation change there, but I didn't really get much. And so that was a waste of money and a waste of time for me. The moment I found out about class 4 laser, found a practitioner, of which there are many around, and you guys will also post a link in our description on all the different class 4 laser practitioners that use the Summus laser. I've been pronouncing it Summus, but it's the Summus laser, which is very well researched, very respectable device. And I now work with 2 different chiropractic practices who use that laser. And the protocols you've set up on that are based on safety and efficacy. And so I've had good experience with that. So we'll put a link in our description also to help people find that for us. So so we know that don't waste your money and time going out buying a cheap, $400, $500, $700 laser. These are medical devices that are needed, and they need to be used by a practitioner who knows what they're doing, and they have the protocol developed for different types of tissue. So that's important, and I'm sure you'll cover that. But tell us, as we talk about tissue injury, inflammation, what's the science and the physiology what's the underlying methods and mechanisms that lasers actually activate in our tissues that reduce inflammation and reduce pain?
Right, that's a good question, because it in part it tells the story why it has taken since 2002 for us to be getting results like this. And it all boils down to understanding it's called mechanisms of action. How does laser actually work in the body? And, when I started doing this in my own practice, the first class 4 laser that I used in my own practice starting in about 2005, it was a device that had only one wavelength of 980 nanometers, and it produced light that was only continuous wave, meaning that that light was constantly on, and there were no protocols. I just had to figure it out all by myself. Now, when I would laser patient with that device, they would get some pain relief, and they would ask me how it works, and I'm like, I don't know. I have no idea. 20 years ago, we had no idea. Now, thankfully, in the time in between, there have been dozens of, if not hundreds of researchers and scientists and clinicians around the world that have developed the mechanisms of action. And partly what you look at is they are called chromophores. What are the things inside of the body that will absorb these photons of light? And when we talk about the mechanism of action for laser therapy, there are a few basic chromophores that we talk about. First is going to be molecules of water. Our bodies are, roughly 70% or somewhere around there, 70% water. So we have a lot of water molecules in our body and in our bloodstream. The second is going to be oxygenated hemoglobin. So we all know that hemoglobin is that molecule in our bloodstream. It has a molecule of iron at its center. And when that oxygenated hemoglobin is carrying oxygen through the bloodstream and a photon of light hits it, it makes it kick off. It makes it release that oxygen at the treatment site. So one benefit that we're getting with laser therapy treatments is increased levels of tissue oxygenation. And actually, I should back up just a moment to point out that absorption by the water molecules, the term that we use is microscopic thermal gradient. And what that means is when we shine the laser light on the tissues, some molecules of water will absorb a photon and they'll get just a little bit warmer, whereas some other photons may not absorb water. And things tend to flow in an area from hot to cold. Okay, that's the way that fluids flow. So the benefit that we're getting with the absorption by that 980 wavelength is improved microcirculation in the treatment area. So we've got better circulation, we've got better tissue oxygenation, and then the third and probably the most important thing that happens is we have trillions of cells in our body, and inside each of those cells we have hundreds of mitochondria. And in the cell, if anyone, if you remember any bit of your biology from high school, you know that inside of a cell there are all these little different organelles. You got ribosomes and all these fun little things, and you draw these cool pictures. Well, the mitochondria, you could argue, is the most important because it's the engine. The cell doesn't live if the mitochondria is not producing energy, okay? And regardless of what type of cell it is. So the cool thing about laser therapy is there's a process happening inside of the mitochondria where it's taking that oxygen and it's taking the glucose, the sugar from our food, from the food that we eat, and it's putting them together and it's producing energy. And the energy is called adenosine triphosphate, or ATP. Now, there is a specific enzyme that makes that process happen more efficiently. But if that enzyme is not working properly, whether it be because of a disease stage or trauma or inflammation, when that enzyme absorbs a photon of light, and most specifically, it's going to be in the range of 800 to 810 nanometers, which is an infrared wavelength. When that enzyme absorbs a photon of light, it produces ATP energy more efficiently, which makes the cell work better, which makes the tissue work better, which makes the organ work better, which makes the individual healthier. So to summarize, it's going to be better blood flow, better tissue oxygenation, and more energy produced by the cell. Now, there are some other more complicated mechanisms beyond that one of them specifically is going to be at the cell membrane surface. There are ion exchange channels. They're called sodium potassium pumps and calcium pumps, and there's other things that exchange ions across the cell membrane. Laser therapy has a positive beneficial effect on those ion channel pumps. So who is that important for? It's primarily important for the patient who is having pain, primarily important for the patient who is suffering from peripheral neuropathy, where they have the constant pain and weird sensations in the nerves, you know, the tingling and the numbness and all things like that. Laser therapy treatments are shown to improve the activity of those ion exchange pumps, which makes the nerves work more normally. Okay, so again, it does get to be fairly complicated. And when I lecture on laser therapy, I have a slide that I borrowed from one of the top photobiomodulation researchers in the world. And I put up the slide and I say, hey, I know that that's complicated. It's extremely complicated. So what I tell you in the next 5 minutes, if you don't understand a single word of it, that's okay. The important thing to note is that there are smart people in the world who understand that and who have developed it and can explain how laser therapy works. So it's really been incredible, Lee, in the last 17 and 20 years that we have had people who have developed those mechanisms of action so we can explain how it works. Now, just a little bit more here. Why is that important? Why is it important to know mechanism of action? First off, it's going to be that we are getting greater acceptance from the healthcare community. So we started out doing this with chiropractors, but now that we can explain what's happening, we are getting greater acceptance by medical doctors, doctors of osteopathy, sports physicians, so on and so forth. So that greater acceptance from the entire healthcare community is important. Secondly, it's going to help researchers develop better studies. Now, we do have thousands of studies on photobiomodulation in the literature, but now that we understand the mechanisms, then we can create even better studies, and we will see more studies being published. And then also understanding those mechanisms, it helps manufacturers to build equipment that will give the best clinical outcomes. So understanding how laser works in the body, it gives guidance to laser equipment manufacturers to build better equipment so patients get better.
That makes perfect sense. It's also very exciting for me because traditional allopathic medicine for me is not, you know, I didn't have good success until I worked with some doctors who, they were MDs, but they were also intellectually curious as to trying new ideas and getting outside of the standard protocol, which is very, very limited for folks with pulmonary fibrosis. There's a couple of medications, pulmonary rehab or lung transplant. And so those were, a lung transplant just didn't seem to suit me at that time. I'm 67 years old, and my health had declined so much. Initially, I couldn't even qualified for a transplant.
Lee, you started out. Were you an Ironman triathlete? Is that right?
Yeah, that's right. I was, and yeah, so I'm a biohacker, I call it. You know, if everybody's familiar with that term from way back. At the age of 50, I started doing triathlons, and eventually did Ironman triathlons, where I'd race, get in the ocean and swim 2.5 miles, and get off there and ride a bike for 112 miles. And then run a marathon at the end of that day. And I started doing that and really found a passion in that. I went from 265 pounds of big powerlifting guy to 185 pounds, lean and in great shape. And then I got COVID and got sick with pneumonia a couple of times after that, which led me to getting a lung condition, and it was eventually diagnosed as pulmonary fibrosis. So my days of swimming 2.5 miles in the open ocean are no more, but I can swim as long as I leave my oxygen tank on the side of the pool and can come back and get some oxygen every now and then. But you know, the interesting thing about the acceptance of the healthcare community, pulmonologists, I've had several, and my most recent one was, before the one I have now, was in Florida while I was there. And he was very curious. In fact, he read my book, and because he had seen how healthy I was and how much I exercised, and I had recovered so much of my strength. And my healthcare practitioner back when I wrote the book actually told me to write it, and she wrote the foreword to the book. So these weren't things I went out and did on my own. I did them in conjunction with some professionals like you. But my pulmonologist in Florida, he saw that I was about to embark on laser therapy. He agreed, let's do a pulmonary function test of all your functions now, and then let's look at it after you've gone through the 16 sessions of laser therapy. And he's a believer now. So this is a great example of here's one his mind has been expanded. He'd not heard of using this until he saw, and he can see the results in black and white, done with hospital devices that cost $100,000 for that machine to measure the pulmonary function and the oxygen gas exchange. So he saw it's really exciting to see the merging of mainstream medicine into more of the alternative, eye-opening methods. I'm a student of light therapy. I have been for years for lots of reasons. I study it. I love that. Interested. Every morning in Florida, it was easier than South Carolina. But in the morning, I make sure that I spend a lot of my morning time sitting outside, letting the sun come into my body. So therapeutic and healthy in so many ways. That red light therapy, natural from the sunlight. But anyway, so I don't want to belabor those points. But I'd be interested. I mean, I've had my own experience. Nobody can convince me otherwise. It's had an effect on me. But there's lots of studies out there. What are, irrespective of whether it's lung tissue or connective tissue, what are some of the most amazing breakthroughs that you may have seen? Any anecdotes, any study, not necessarily studies, but patients who've had experiences that really changed their life?
Yeah, I think, just in general, being able to help those people who were at their wits' end. And Lee, literally, we have had patients who were seriously considering committing suicide because their pain was so intractable. Wow. So a couple of those, some of these patients that I'll talk about, I have met in person, and other ones I've just been able to read their testimonials. But I'll start up top with trigeminal neuralgia. It is a nerve condition, a very painful condition that affects, it's called a cranial nerve in your face, and you'll get pain into your forehead, in your sinuses, and then down into your jaw. And it's a pain that's with the patient 24/7. And typically, they would put people like that on heavy doses. They may even need to be taking the opioid pain prescriptions. And just as an aside, I think one thing that's really rewarding is being able to use laser therapy so that a patient can either reduce or eliminate their need for taking opioid pain medications because of their addictive qualities. So anyway, I do know that we've had many patients suffering from trigeminal neuralgia, that constant 24/7 pain, that they were considering ending their own life. But the treatment for it with the laser, I know of many that have done 10 or 12 treatments with the laser, and it completely takes the pain away. Wow. So, just being able to use the laser to make those nerve fibers, those pain sensing nerve fibers work normally, that's very rewarding. Okay. Then I'll go to the other side of the body in the feet. And again, I'm just going to reiterate the disclaimer here. I'm not making any specific medical claims or medical advice. I'm just telling you the story of many patients who have been helped in this way. Okay, so the diabetic patient. Patients with diabetes, especially if it's been with them for a long time and out of control, they have poor circulation in their feet, in their lower extremity, in the toes and the feet. And it's because of the effect of gravity, because of that long distance. So they have problems with circulation and blood flow to the toes and the feet. They start to get that diabetic peripheral neuropathy, which is it can be very painful for them, or they may feel like they are standing in a campfire or walking on marbles. They may lose those proprioceptive nerve endings in their feet so that they have trouble with balance. They may slip and fall more easily. Then also they may not be able to feel the brake pedal in their car, which creates an unsafe situation. If they are, someone who is wanting to stay independent, if you can't feel the brake pedal in your car, that's not a safe.
That's scary.
So another thing that goes along with diabetic peripheral neuropathy is, since they can't feel their toes and their feet, if they step on something sharp, or if they get a nick or a cut, or I've even heard from diabetic neuropathy patients that even when they clip their toenails, they have to be extremely careful, because if their toes are numb and they would happen to cut their skin down there, then that can lead to problems. So a patient with a diabetic wound that in the legs or the feet that does not heal, they face about a 50-50 chance of having the limb amputated. And diabetic peripheral neuropathy is the #1 cause of non-traumatic amputations. Okay, so we're setting aside cases of trauma and things of that nature, but the patient with diabetic peripheral neuropathy, it's the leading cause of non-traumatic amputations. So I know that we've had cases of patients with severe wounds on their feet and on their legs where they were scheduled to have that limb amputated. And, you know, first you have to think about the trauma and the effect on that person, you know, going through the limb amputation, but then also you have to look at the costs involved. Right now, the last numbers that I've seen, the lifetime healthcare costs for a patient who suffers an amputation is over $500,000. Now, Lee, I have documented cases that I can show you. I can show you the pictures and share you the information about the case where we do the laser treatment for these patients with diabetic peripheral neuropathy, and we get those wounds to heal. The wounds will heal, and wow. That's something that you know, with all credit to what modern medicine has done to improve quality of life, modern medicine does not have an answer for diabetic neuropathy, and especially when there are wounds in the extremity. So when we can take a patient and put them through a series of treatments with the laser and get that wound to heal up and also restore their proper sensation so that they can be an active, independent individual, that's mind-boggling. That's just
huge. That's huge. And the healthcare costs, we're all focused on healthcare costs right now in this current climate, and the healthcare costs for all sorts of chronic conditions like that are huge. And you know, this is such a simple, you know, economical approach when you consider using light therapy to be able to heal something rather than amputate a person's foot and have them for the rest of their life so deeply impaired. That's terrific. That's a great use case there.
And I think it's important to point out, if people are not familiar with Class 4 laser therapy, first off, the treatments are pain-free. You just might feel a little bit of a warm sensation in the treatment area. The treatments are using laser light that is red and infrared, so it's non-ionizing, and therefore the treatments are completely safe, you know, virtually free of side effects. Now, sometimes when someone gets their first laser treatment, a few hours later, they might have a little bit of soreness in the area, and that can be explained by the increased blood flow that we get in the area. It can be explained by the tissue irritants. They're called kinins. When we get these kinins released from those tissues that have been diseased or damaged, that can cause a little bit of soreness. But it's just important to point out that the treatments are non-ablative, non-invasive, but they can also be very, very helpful. And then, you know, we could spend all day talking about all of the different conditions that patients have had that have benefited from the laser treatment. In general, anywhere there is pain, inflammation, or damaged tissues, pain, inflammation, damaged tissues, potentially laser therapy can help. And I put in potentially because I'm always an under-promise and over-deliver sort of guy. I am not going to tell you that laser therapy is going to be 100% effective for every condition in every patient. But when used as a part of it could be used alone or used as a part of a treatment plan by a chiropractor or a physical therapist or other healthcare provider, Class 4 laser therapy is just changing lives of people all around the world every single day.
That's a great point. And, you know, for me, I wanted to make this point. I'll make it now. I didn't view this as I don't view any single thing. I got a lot of different things I do every day, very disciplined, very consistent things I do and have done for years. And that's why many of the reasons why I have experienced such a profound turnaround from being an invalid, planning my funeral, and kind of giving up on life to now vitally a part of connected to life, able to do activities, working out in a gym 7 days a week, walking 4 miles a day, 10,000 to 14,000 steps every day, all those things. But that's so critical is that folks, I tell people when they say, gee, how'd you have this? Results of mine have been published pretty widely that I had a 64% improvement in my oxygen gas exchange in my lungs after the 16 sessions of laser therapy. I had 64% improvement in that. It's phenomenal, unheard of. And they said, how'd you do that? I said, it's not a silver bullet. Don't go in and think, I'm just going to go. It's not a passive activity. You get the laser therapy done, but you need to exercise and you need to do breath activity, breath training, because those are things I do to expand my lung capacity, to improve the overall terrain of my body with lots of good physical exercise, proper nutrition, proper sleep, stress-free mindset, those sorts of things. So it's so vital that we don't just approach this thinking we're going to walk in and get a quick fix or that sort of thing. But it's so exciting to hear about it. I'll tell you one ancillary thing that happened with me after I started back walking and got up to a couple thousand steps a day a few years ago. Every time I'd walk in the morning with my dogs, I'd have this big broad pain. It was like a sheet of pain on my back of my right lower back, from my waist up to about my shoulder blades. And it was like, I thought it was fascia, and I'm sure it was the fascia, which if you don't know about fascia, there's lots out there on fascia release, myofascial release. So I went to a myofascial release place. I went to massage therapy. They did the cupping and things like that to try to relieve me of that pain, but it was hard. It was very painful. And it was possibly because that's where my lung disease was worse. The lung scarring had actually deformed my lung. And so everything in that area had kind of cramped up. But it was something I dealt with every day. I just learned to deal with it. I'd go for my walk in the morning. After a few hundred yards, I'd have to stop and stretch that area out and do all these contortions on the side of the road while I'm walking with my dogs to get the pain to go away. After laser therapy, I haven't had one instance of that pain. So the laser therapy, the waving of the wand of the light over my back, where it's working on the lungs, the tissue of the lungs, has also had an effect on the fascial of that area, and it has brought blood flow, reduced inflammation, and that pain is gone. And I marvel at that side. That's the side effect that I've experienced, is further elimination of pain. So it's a great testimony for the overall therapeutic value of that. Anyway, okay, well, let's see. Does that bring anything to mind that you want to cover also?
Well, I do. Before we end it, all right, I know we have time left here yet, but
sure.
I just want to make sure that people hear the story of Dr. Andy Hall, and I want to give him credit.
Please do. Yes, please do. Absolutely.
He's the guy where this all started. So I had known Dr. Andy Hall. He's in Sonoma, California, chiropractor, been in practice for many, many years. And I had known him. We've been friends and a little bit of part-time business colleagues. And so we would see each other at seminars. Most frequently, it would be it's called Parker Las Vegas. It's a big chiropractic convention in Las Vegas. And so we would see there and we would chat. And I was, working with the laser company, and he decided to purchase another brand of laser, and that was okay. That's fine. I get it. But he did have a class 4 laser. And then in 2014, he was diagnosed with IPF, with idiopathic pulmonary fibrosis. And at that time, there was no knowledge of laser for this condition. Dr. Andy Hall is the guy that started it all. So he was essentially told, within 5 years, you have an 80% chance of being dead. And I can't even imagine getting that message. Wow, it must be such a crushing message to get. And I'm like, oh my gosh. So Dr. Hall, he looked at his class 4 laser and he says, well, I've got nothing to lose. So he started to laser himself. And that device, it used 2 infrared wavelengths. It was 10 watts of power, and it was continuous wave only. And so he would laser his anterior lung fields, and then he would have an assistant laser his posterior lung fields. And the cool thing is that after a period of time, he was getting the pulmonary function test. They did start to improve. Now, the interesting thing is that he had a chiropractic friend who was, this gentleman is now deceased, a chiropractor friend in Sacramento who had a different laser that was able to produce continuous wave, but then also various pulsing frequencies. And this other laser used 4 wavelengths. It used one that was red and 3 infrared wavelengths in this class 4 therapeutic laser. And so this friend and Dr. Hall started to work together, and they would treat Dr. Hall's lungs. And, you know, since Dr. Hall was the patient, he could feel himself if the laser treatment was going to do better. So he and this friend, the friend's name is Dr. J. Rod McGinnis. Again, I say that he's now deceased, but they worked together to develop the protocols that Dr. Hall now promotes through his website, IPF Laser Study, IPF Laser Study. He has a very nice PDF there that gives the story of laser and using the proper protocols and things of that nature. But what's interesting, one interesting thing about laser science is when Dr. Hall used the laser that was continuous wave only, he got some benefit. But once he started to use the laser that had 4 wavelengths and was doing, it's a pulsing frequency where that laser light is flashing on and off at different frequencies, he was able to feel a marked improvement for himself. Now, whenever I tell a story as part of any laser lecture, I always point out there's always a happy ending. Okay, so remember that Dr. Hall got diagnosed in 2014, told that he would be dead in 5 years. Well, guess what? 10 years later, Dr. Hall is alive. I think he did fully retire, but he was in part-time practice for the last couple of years. He goes hiking at altitude in New Mexico.
Wow.
He rides his Harley. He's fully active. And the cool thing is that he is so generous of his time and his advice. He's been active on various internet message boards and Facebook groups, just so generous in communicating with patients and with doctors on the use of class 4 laser therapy for lung-related conditions. So I am so grateful for Dr. Andy Hall. He's a real gem. And another interesting thing about laser science that I like to point out is, again, he was diagnosed in 2014. The very first published scientific paper that I can find on use of laser therapy for lung fibrosis was published in 2020. So 6 years after, and that was a study just using mice. You know, a lot of the studies, the medical studies are done on small animals. So this was done on mice, and they would induce lung fibrosis in the mice, and then they would laser them, and it showed improvement. So I point out that, you know, if Dr. Hall waited for a published study to come out, you know, he would have been dead. And so I'm all in favor of having published studies on laser therapy for different conditions and showing its effects and mechanisms. However, there are things that we are doing clinically with the use of these devices. We're about 8 to 10 years ahead of the published research. And again, I'll just go back to the fact that the laser treatments are completely safe, non-invasive, virtually free of side effects. So if a patient does have a condition, and believe me, over the last 17 years, I've gotten lots of very strange and weird conditions about, will laser help this or will laser help that? And if it's a condition that I don't have any experience with, I will say, hey, try it. It's completely safe. I'll recommend some parameters or settings or a treatment schedule. And more often than not, the feedback I get a few weeks later is the laser worked. So it's just really, really exciting. But again, I did want to give credit to Dr. Andy Hall for everything that he has done.
You know, his was one of the first articles I read, the PDF that you spoke of, and connected with him because I'd done my study on laser therapy. A friend of mine in India actually said, class 4 laser therapy, we've got to try it, but I have no practitioners here in India. And so I did some study and I said, I see there are a bunch of them in the US. I'll be the guinea pig. I'll try this out. And so I did a quick Google search, class 4 laser therapist near me. And I found Dr. Serpentelli, who's a Summus Laser therapy provider in Bradenton, Florida. And they called me back on Monday. This was Saturday night. I sent an inquiry. They called me Monday morning. I started my laser therapy on Tuesday. I didn't need. They initially provided the article about Dr. Hall. I actually connected with Dr. Hall through one of the social media groups, and I found him to be so generous with his time. And that's how I also met you, also through that avenue. The great social media makes the world a smaller place. But I don't wait around on published studies. If I've got some medical science behind something, I'm willing to be an N of one, a study of one, or a guinea pig, and I love it because it's had a profound effect on my health, my ability to be. I mean, I've got an oxygen cannula. I didn't get cured. I've recovered. I've got an oxygen cannula, and I use that when I go to the gym. I work out with oxygen, and I'm 67, and I can do more than most 45-year-olds as long as I got my oxygen tanks. But it's, that is it's important to keep that exercise up. When I moved to South Carolina after the hurricanes in Florida, first thing I found before I found any other practitioner was to find a medical grade laser therapist and who uses the Summus lasers, because I knew you guys have the protocols that and you knew what you were doing. So I found Dr. Boyson and a chiropractor here in Columbia, South Carolina. And I started therapy the week after I arrived here, and I've continued that. And I'll tell you a quick story. Dr. Matt there, his sister, Dr. Amanda, she is a chiropractor also in the same practice. She does animal therapy as a chiropractor, which is an emerging market, and not emerging, it's been around for a while. And she's doing laser therapy. I've seen laser therapy done on racehorses, these $1 million racehorses where they have been able to get problems solved, that sort of thing I've read about. But so I went to to get my laser therapy done. And I mentioned something about taking my dog to the vet a few days before, because my 14-year-old dog, he's developed a bad limp for some reason. I took him to the vet, and they said, oh, it's a problem with his patella, and we would recommend a surgery. That's about $4,000. Well, he's 14 years old. I don't want to put him under, and I don't want him to go through all that trauma. And I said, well, I'm just going to let him limp for a while, and we'll see how that works out. And I told Dr. Amanda about it, and she said, well, bring him in. I said, well, he's in the car. She said, bring him in. And so we started laser therapy on Nemo, my 14-year-old, 14-pound Yorkshire Terrier. And he's had now 5. When I go get mine, he gets a laser treatment the same day. And he's now had 5 laser therapies. I sent them a video before they knew. He ran carrying his left rear hind leg. He just carried it the whole time. I've sent him several videos on my walks in the morning. He and I did 2 miles this morning, up and down hills, and he's walking perfectly. So it's alleviated his problem. It could have been a very traumatic surgery that's very risky for older dogs. It's just I know there are limits to what can be done, but we're going to push the boundaries and with this. And so it's great to be a part of emerging medical science like this. It's doing so much good for so many people.
Agreed. Yeah. Yeah, that's one thing we'll point out to skeptics is that with a dog or any animal, there's no placebo effect.
Yeah.
Placebo effect might work on people, but and for so many other dogs that they were considering putting them down. Especially the dachshunds, because of the biomechanics of their spine, they were considering putting the animal down, and then 6 treatments later with the laser, they're up and running around like normal.
Wow. So, that's beautiful.
Yeah,
that's beautiful. I wish I'd have had that back in the days when I had corgis, because they were long like dachshunds. They tended to overweight and had some serious spine problems there with that. But that's great to be a part of that. So I guess we ought to wrap this up. We could probably talk for hours, and we could probably do another round on this at some point in the future. It's going to be great to hear. I hope you post some pictures and things from your trip to Malaysia. Is it Malaysia?
Right. Yeah. So actually on my website, and I think you said you'll put the link to my website.
I'll do that. Yes.
Yeah. So I do have a page that I call my World Laser Travels. So it's I am beyond blessed. I just could not imagine that laser would have taken me this far. And I also say, I have not worked a day of my life for the last 17 years. This is so much fun to just talk to people about laser and see their quality of life improve. So on my World Travels page, the very first international trip that I took was to India. And so I went to India. The group picked me up at the airport, and that was fantastic. Every morning I was awakened by the peacocks howling, oh wow, oh wow.
Yeah.
And that was cool. But the most fascinating thing is that we would go to Hindu temples, and in the Hindu temple, the Hindu holy man, the Hindu priest, would be sitting on an elevated platform, cross-legged, and speaking with his with the people there. And so then we went into the priest's private quarters, and I mean, granted, he's a Hindu holy man, but when you sit cross-legged for hours at a time, you're going to have knee pain and you're going to have sacroiliac joint problems. So it was so much fun. I went there, we brought the laser in, and I lasered his knees. And then I could tell there was a pretty severe sacroiliac dysfunction problem going on. So if you're familiar with the technique, you lay on your side, and I gave him a side posture adjustment on his sacroiliac joint. And to think that I would be, giving an adjustment to a Hindu holy man in a temple, it was just fascinating. But then I've had other travels to other very interesting countries, going to the Baltic states, Latvia, Lithuania, going to Romania, again, going to Malaysia, and other countries. It's so fascinating to visit these different cultures, but then it's also very rewarding to see that Class 4 laser therapy is being embraced by these healthcare providers all around the world, and patients are getting better every day. It's just incredible.
Beautiful. That's a great story. I mentioned my friend in India who wanted to get a treatment with the Class 4 laser, couldn't find it locally where he was, and so he wanted to order one, and he had great difficulty figuring ways to get one into India because it's a medical device. He struggled with being able to find one, and they're very expensive. These are not consumer versions, of technology. The last thing I'll mention now, a few things, housekeeping notes. The important links are going to be in the description below. A number of links for Dr. Harrington and that he's mentioned. Thank you all very much for watching this podcast. Just please know also that I'm retired. This is my unpaid job to do this. I don't do this for money. I have no commercial affiliation with any person or product that I mentioned. None, zero. Any money that comes from the book I wrote, I donate to the Pulmonary Fibrosis Foundation. So it's this is my, I don't work now. I mean, I'm retired and I enjoy this work like you talked about. I don't work a day in my life anymore. So I can relate to that. So there's no commercial. And also, this is an information only channel, just like Dr. Harrington says. I'm not a medical provider. I'm a patient, just like many of you may be. And I'm just sharing what has worked for me and what I'm finding out there in the world for all of us to look into and perhaps try. So thanks for watching this. Please remember to press the like button and press the subscribe button at the bottom of this channel, and it'll get you the opportunity to get more videos on this as we do more videos on healthcare for lung disease or general types of recovery and anti-aging videos. Also, use the comments portion. If you've got a question, ask me the question. If I can't answer it, I'll link it back to Dr. Harrington, and we'll try to get your questions answered. And use your comments to just tell us if you like this and if you'd like to see more like this. So thanks, Dr. Harrington, so much for giving us all this great time today. And your clear explanations is clear to me that you're passionate about this, and I love what you're doing. I'm really thankful for what all you guys are doing. So thanks very much.
Well, thank you, Lee. I'm so glad that Laser has brought us together. I'm sorry that you had to go through the difficulties with your condition there for a while, but I think you should get a round of applause for doing things like this podcast and writing your book and donating the proceeds to the foundation and things of that nature. So I'm so grateful to have met you through Zoom, and I look forward to hopefully meeting you in person someday. And just thank you for the opportunity. I appreciate it.
My pleasure. Thanks everyone for watching. Bye now.